Hey everybody, Mike with the Quit Sugar Summit, guys. I am super excited. Dr. Chris Palmer from Harvard is in the house here, and it's just his book is going to be the book of the summit. His new book coming out November 15th, right, Chris?
Yes.
November 15th on Amazon. You can pre-order it now, called Brain Energy, right? And it's just the last time we spoke, the message was so clear about his work, and the book is the encapsulation of all that work, and it should be, I think, change a lot of diet and brain connection for years and years to come, because we've known about it here on the summit from speaking with him over the years, but this book I think is going to be super. And let me give you a little bit of the background, just so you know. I mean, it's not like I have to whatever, medical degree, Washington University of Medicine, intern psychiatry residence at McLean, which is in Massachusetts General, and Harvard Medical School, and currently director of Department of Postgraduate and Continuing Education at McLean Hospital, and assistant professor of psychology at Harvard Medical School. So I don't think there's a lot more in there, but I'm gonna let him tell you about it. But that's probably all you need. That doesn't really need an introduction, but Chris, thanks for doing this. I really appreciate it. As I told the folks, the book is coming out November 15th. It's Brain Energy. It's in pre-sale now, guys. Grab it, and Chris will tell you. We're going to kind of go through the high level. We talked about the high level of the book, but before we do that, tell them your story. Tell them how you became this so fascinated with this, and then your successes with it, and how you ended up writing this book.
I will try to be brief, because I could talk for the whole hour on that alone. But okay. The quick version of the story is that, you know, I set out, like so many other people in this space, just to improve my own metabolic health, you know, well over 20 years ago. Because I was already in my 20s, already had metabolic syndrome. Wow. I had a history of depression and other problems, OCD and some other things, when I was a kid and young adult. But at the time that I tried this, I actually didn't meet criteria for any serious, you know, kind of mental diagnosis. But you know, I ended up trying a ketogenic diet to improve my metabolic syndrome. And, you know, within 3 months, it was improved. My blood pressure was better. All my lipids were better. Everything was better. But the thing that I noticed most was a change in my mood, my energy level, my confidence, my sleep. Everything was better. Life was just easier. Yeah. And so, you know, I started recommending the diet to a lot of friends and family, noticed equal results in many of them. And so started wondering, could this help people with treatment-resistant depression? Because I had, you know, lots of those people in my clinical practice who had already tried, you know, numerous antidepressants and years or decades of psychotherapy, and some of them had even had, you know, electroconvulsive therapy or shock treatments, and nothing was working for them. And so I thought, wow, this is a really powerful effect in me. I wonder what it could do for them. And I started using it probably about 20 years ago in those people. And lo and behold, it was working for some of them. But I pretty much stayed on the down low because, you know, the ketogenic diet is controversial today. It was even more controversial back then because we didn't really have the research studies published in the literature showing that it was safe and effective for weight loss or other things. And that all changed for me in 2016 when one of my patients with schizoaffective disorder asked for my help to lose weight. And we decided to try the ketogenic diet. Within a couple of weeks, I noticed this profound antidepressant effect. And it took probably 6 to 8 weeks. You know, it doesn't happen overnight. But within 6 to 8 weeks, I started noticing a dramatic change in his schizophrenia, essentially. He just spontaneously was telling me that his auditory hallucinations were going away. His longstanding delusions were going away. He had all these paranoid conspiracy theories that people were out to get him. They could control his thoughts. They could control his mind. And he began to realize that those things weren't true and probably never even had been. That man went on to lose 100, like now it's over 160 pounds. He's kept it off to this day. He was able to do things that he had never been able to do since his diagnosis. He was able to complete a certificate program, able to perform improv in front of a live audience. And those are things that he would have never been able to do before the diet. And, initially I was just shocked. I really was shocked. I had no conception that something like a ketogenic diet could put an illness like schizophrenia into remission or even dramatically reduce its symptoms. And so I went on a journey to try to understand how and why would a diet do this for this chronic brain disorder?
Mm-hmm.
And, quickly came upon the epilepsy literature, although a lot of people are focused on, weight loss or diabetes, and they absolutely play a role in mental health. There are extraordinarily clear, direct connections between seizures and mental disorders. And probably the most direct connection is that we use anti-seizure treatments in psychiatry every day in clinical practice in tens of millions of people. These are treatments that we use all the time for a wide variety of diagnoses, including psychotic disorders. And so when I realized that this treatment is an anti-seizure treatment, that was probably the most powerful thing in my mind. It's like, oh my God, well, if this is an anti-seizure treatment, then wow, it's like a no-brainer. Of course it might help psychiatric patients. So I started using it with other patients. It was equally effective. And my career has changed course and exploded in so many ways over the last 6 years as a result of this.
Right. That's amazing. It's amazing. So tell us, brain energy, interesting title. Tell us why you named it that and what the parallel correlation is to this work that you're doing.
So brain energy is really a culmination of all of the work that I've been doing over the last 6 years to try to understand how, how a ketogenic diet can stop seizures. I actually started writing a book on the ketogenic diet for psychiatric disorders. And I quickly realized nobody's going to believe this. It's just, nobody's going to believe it. And I'm going to be like so many other professionals in the low carb keto community, feel like I'm banging my head against a wall, getting nowhere, not really changing clinical practice, not getting other doctors or scientists to take this seriously. And even in the epilepsy world, we have a good amount of randomized controlled trials showing that this works for seizures. And still to this day, the majority of people with treatment-resistant epilepsy are not told about this as a treatment option.
Wow.
And I saw that and recognized that and thought, well, I don't want to be that. I don't want to go through all this work and then end up where they're at. And not to disparage them. I like, God love them and praise them for everything they have done. They have definitely advanced the field and they have helped thousands and thousands and thousands of people. I don't mean to minimize that or disparage that, but I feel strongly this treatment should be offered to every single patient with treatment-resistant epilepsy, and it is not right now. And actually, a lot of patients are, talked out of it or told don't do it. And so I decided the strategy I would use was to try to understand the science and connect the dots more thoroughly, hoping that science might persuade the medical field. And the more I dug into the science and started connecting the dots, that journey led me to a place that I never imagined I would get. I actually left the mission of the ketogenic diet and instead ended up pursuing a much larger, and in my mind, more important question, which is what causes mental illness? And how can we really understand mental illness? And because again, I recognize, if we just say, well, the ketogenic diet might work for 10% of people with this disorder, then everybody's going to think, well, they must have just had some rare variant of something, some nutritional deficiency or some genetic problem, but that won't work for everyone.
Right.
And so instead, I was focused on, well, how can I put this together and put together a model that will work for everyone? And so I knew that I needed to think much more broadly than just diet. I needed to be thinking about stress and trauma and drug and alcohol use. And I needed to be thinking about sleep and genetics and epigenetics. Like, what do we know about them? And how can I fit that all together to understand this big picture question, what causes mental illness? And that process led me to connect so many dots that in my wildest dreams, I never thought I would have been able to connect, quite honestly. It sounds kind of crazy. I know it. I'm gonna acknowledge that. But the conclusion, the 40,000 foot view of the book is that mental disorders are metabolic disorders of the brain. In order to understand what that means, you have to understand metabolism. And metabolism is very complicated. It is controlled by many things. Diet is one of many things that influence metabolism. There are a lot of other things like stress and sleep and drug and alcohol use and epigenetics and other things that are playing a role in metabolism. But so in that sense, this is kind of a no-brainer, and it's actually really obvious. We have research dating back to the 1800s showing that people with mental disorders are much more likely to have metabolic disorders, including things like diabetes. That we've known that before we had our psychiatric medications. A lot of people think the reason like so many people with mental illness are overweight or diabetic or they're dying early deaths is because of the pills that we're prescribing. And there's no doubt that the pills we're prescribing are adding insult to injury and making things even worse. But we've known about these connections since the 1800s, before those pills were even invented. And since the 1940s, researchers have been discovering all sorts of parameters of metabolic abnormalities in people with mental illness. And this includes metabolic abnormalities in their bodies. So like we can draw a blood sample and see metabolic disturbances, or in their brains. And so, a lot of people familiar with the mental health field know that, we do all these brain scans on people with mental illness. And we have thousands and thousands of studies showing that there are differences in the brains of people with mental illness compared to people who don't have mental illness. Guess what they're measuring? All of them, all of these functional brain scans are measuring metabolism. That is what they are measuring. And so in that sense, a lot of the scientists are going to hear me say mental disorders are metabolic disorders of the brain. They're going to say, yeah, Chris, well, we've known that for decades. Where have you been? Like, big deal. When you take a broad overview look at, well, what is controlling metabolism? Like, what controls metabolism in the human body? Like, what is a metabolic problem? How can we define a metabolic problem? What does that mean?
Mhm.
When you actually get really concrete with simple questions, I mean, those are basic questions. A lot of people can't answer those.
Right.
But I'm like, over the last 6 years, I'm asking myself these basic common sense questions. Well, wait, if it's a metabolic problem, what does that mean? Like, what is similar about obesity and diabetes and cardiovascular disease? Those are all metabolic problems. Like, how do they connect? Like, what connects them? What is it that connects all three of those? And it's more than insulin. I'll just say that insulin is a big player in metabolism, and insulin resistance is absolutely unequivocal, a strong biomarker for metabolic problems, but it's more than just that. At the end of the day, I think the primary regulator of metabolism are these tiny things in our cells called mitochondria.
Mhm.
And once you understand what mitochondria are and what they're doing in the cells, that's when you can actually start to connect the dots of mental illness. So, and that is what my book does. So my book starts off with kind of where we're at in the mental health field today, and all of the tragedies and frustrations and the hopelessness and the anger that people experience about the ineffectiveness of mental health treatments today. I mean, mental illness is the leading cause of disability in the United States and throughout the world. And the number one diagnosis, like most people know, well, schizophrenia, almost everybody with schizophrenia is disabled. And a lot of people with bipolar disorder are disabled. Those aren't the diagnoses that are topping the list. The top of the list of all medical conditions that disable more people is depression.
Mm.
And we have dozens and dozens of treatments for depression. We have lots of antidepressants, and we've got shock therapy and TMS, and we've got psychotherapy and group therapy and positive thinking and self-love. And we've got so many treatments. And guess what? Those treatments aren't working for millions upon millions of people.
Mm.
And so we need to better understand this basic common sense question. Well, what is causing depression? Like, we're not going to be able to get to better treatments if we don't understand the answer to that question. And so my book starts people off with where we're at today. I highlight all of the problems. I highlight some of the successes too, because we do have some successes. I'm not here to completely bash my field.
Right.
But then I move on to putting it all together and looking at the strong connections between what we call mental disorders and metabolic disorders. There are many strong connections, and they go in both directions. People with obesity are more likely to have a mental illness. People with mental illnesses are more likely to develop obesity. Same with diabetes, same with cardiovascular disease. And once you understand that, then we can start to look for, so what do they all have in common? And when we start to think about what's happening in cells and we start to look at mitochondria in particular, you can actually begin to make sense of everything in the mental health field. You can start to make sense of how does stress not only cause mental illnesses. If people don't know this, stress causes mental illness, yes, but stress also causes heart attacks and strokes. Stress causes obesity and diabetes. Stress makes diabetes worse. If you have somebody with diabetes and they get stressed all of a sudden, their blood sugars will go up just from the stress alone. And so this theory, the brain energy theory, helps connect all of the dots between these, these questions about, like, how are mental health and metabolic health related, or how are mental health and physical health related, I do my best to connect the dots in clear ways. It is a science book. I'm gonna say that. And if you hate science, I'm gonna go ahead and say it anyway. If you hate science, you are not going to love my book, or it's going to be a little bit painful to get through because there is science in this book. And I'm citing studies, and I am going to talk about mitochondria and cells in this book.
Right.
However, if you actually want to understand mental illness and what you can do to fight it, you've got to read this book. I'm sorry, there's just no way around it. So
Yeah.
either you're going to deal with the science, or I guess if this book does really well, I'll write the dumbed down version for people who hate science. Maybe I'll write a simple version for them, but you'll just have to wait. And if you or someone you love has mental illness, well, good luck, suffer through that. And I hope something bad doesn't happen to that person in the meantime. But I wrote this book with a clear mission to provide enough evidence and enough science to convince the medical community that they have to take this seriously. They have to pay attention to this. So I will shut up and let you get a word in edgewise.
I love it when I just turn you on. That's good. That really was good. I appreciate that. So, I mean, first of all, I've always considered your message very clear. Isn't the phrase, if you can take a complicated subject matter and make it simple, then that's genius, right? The reverse is not always true. But so, I mean, I think you do a great job at that. And suffering through it, I don't think would be the issue. So I told you the story of my number one coach, who is, came in 4.5 years or 4 years, a drug addict, a clean drug addict, but on bipolar meds. And she doesn't mind me telling the story, by the way, on bipolar meds, and 50 pounds overweight, and, really having a tough time, depressed and the whole thing. And, 3.5 years later, 4 years later, she's like a different person. I mean, she literally is, the weight's gone, the bipolar meds are gone, not from us doing anything. Her doctor, you know what I mean? We went to her doctor and fixed that. So, I mean, I want to know, like, obviously, my holistic view of the world, and I think maybe yours is becoming, that the food is at the core of this, the metabolic illnesses, there is no difference between metabolic illnesses causing obesity and heart disease and possibly Alzheimer's than the I guess what they're calling inflammation of the brain, which is a vivid enough picture, I think, and that the brain shrinks. We've had different scientists on say that the brain shrinks, and the scans, they have holes in them, literally. Like, what does it take for the scientists to get on this bandwagon, or the people prescribing the pills, which not big in my world, but I know you still, practice that a little bit. But tell me what your thoughts are there, as far as like, what does it take for people to understand this? And I know the book's going to go a long way, but what do you think?
That was my mission in writing the book.
Yeah.
So I knew that, or I assumed that if the message is, if we just change diet in everyone, we would stamp out mental illness. I realized that's not going to fly.
Okay.
Because I don't think that's true.
Okay.
So you could give me somebody on a ketogenic diet, and if I put them in a horribly abusive relationship, and I tell them to drink a pint of vodka every night, and I tell them to smoke lots of weed, and I tell them to be on screens all night, don't sleep well, they are not going to be mentally healthy.
Okay.
They're just not. Because those other things are playing a role in their metabolism. those other things are playing a role in their metabolic brain health. So I am hopeful that my message in the book it really covers all of the bases. I mean, for the last 6 years, I have been ridiculously obsessive and persistent. And I will tell you, like early on, I didn't really, I questioned my own theory. I was like, this can't be true. I can, number one, I'm not smart enough to have discovered like this big unifying theory of mental illness. That's number one. Number two, it can't be as simple as it is in my head. Like this is so obvious and simple once you see it. But so I've been obsessive, kind of playing devil's advocate with myself, challenging this theory. Like if it's really true, then that should be true. If it's, if metabolism is really related to mental illness, then we should see a link between obesity and autism, for instance. And in fact, we do. Women and men, both, fathers too, who are obese are more likely to have autistic children. People with autism are more likely to become obese. If you pair obesity with type 2 diabetes, the rates go up to like a 3 to 4-fold increased risk. If a mother has both obesity and type 2 diabetes, the likelihood that her child will have autism goes up 300 to 400%. And that's one example. We know that the rates of autism are skyrocketing. They have more than tripled in the last 20 years. Tripled. And a lot of people and researchers are scratching their heads trying to understand what the hell, how is this possible? Autism is a neurodevelopmental disorder. Like what is going on? Most people think it's genetic. Well, I can tell you when something triples in 20 years, it's not genetic. Genes might be playing some kind of a role, but it is not a purely genetic disorder when something triples like that. And the elephant in the room that everyone is missing is that at the same time that metabolic disorders are skyrocketing, at the same time obesity and diabetes are skyrocketing. Oh, by the way, mental disorders are skyrocketing. Which mental disorders? All of them. Pretty much all of them. And so my hope is that by going big, by really doing a 60,000-foot view and looking at, so here's where diet fits in, but here are where these other things fit in as well. That if I'm hoping that by doing that it will get more credibility, it will get people talking more. And, at the end of the day, the rubber, it's all about showing proof. And so I am working with researchers, clinicians, philanthropists, other people. I mean, there are lots of people working on this now. I, by no means, am alone doing this work. We've got teams of people who are passionate about moving this forward. And some of the researchers have been doing it much longer than I've been doing it. This has been their career. And so I think they finally feel vindicated, like, yay, we're finally moving forward with this. But at the end of the day, I think if we can demonstrate that we can get people better, the woman that you described, if we can get more people who are on bipolar medications or schizophrenia medications or depression medications, if we can get them better with our treatments, the mental health field will have no choice. Because if we can demonstrate that through science and through efficacy, mental health clinicians overall are really good, caring people. I know they will do the right thing. if there are any holdouts that don't want to do the right thing, the reality is they will face criticism.
Mm.
You know, if everyone else is getting better and their patients aren't getting better, people are going to scrutinize them and be wondering, like, what's going on? What's wrong with that clinician? Their patients are all disabled, and yet all of these other patients are getting better. Like, and you know, and that'll have consequences for those clinicians. I'll just leave it at that.
No, I appreciate it. So I want to tell you something that'll be a little bit of a shocker, I think. So, you know, I started in late stage food addiction, and this is 2 and 3 people, 200 and 300 pounds overweight, losing limbs, going blind, and they still couldn't quit sugar. And so I got a lot of people like, you know, I've got over 1,000 written testimonials, success stories, and we're trying to get some graduate students in to, you know, quantify this a little bit deeper. But a shocker, the big shocker was when we do a little our informal or formal surveys of the folks. Now, these are folks, like I said, lost tons of weight, diabetes 2 remissions. I actually genuinely believe with all my heart, after watching all of the remissions that I've had, both physical and mental, that 85%, this is my own personal opinion, 85% of, you know, all maladies, mental and physical, are caused by legal sober drugs, you know, flour, sugar, caffeine, alcohol, that kind of stuff. And not to mention the prescription ones or the illegal ones. But, you know, I tell you that the survey came back. It wasn't about weight loss. It wasn't even about type 2 diabetes. Everybody raved about their processing power returned, their memory returned, their ability to work, sleep, their anxiety lessened. All of these are the things that they were raving. And these are people that lost 100 pounds or put type 2 diabetes in remission. These are people who had, you know, by their diet change, changed the direction of their life. And they didn't talk about the weight loss, and they talked about how their brain, the term they used, brain came back online.
Yes.
And now people are doing this, like the same thing in the other direction. They're coming to us because they've heard these stories. So, I mean, and yes, you are smart enough to invent or at least popularize the unifying theory that it's the diet, stupid. It's like that. This is the thing, you know. Anyway, I don't want to rant and rave about it, but what question am I not asking? I don't want to run out of time here. What question am I not asking? What is the? I think we're kind of there, but what's the? I think I always ask that question too early. Like, what's the long-term goal? Why do you, you know, why the passion? And there is passion, and I appreciate that. So to get this done, and also I'd like to know a little bit about these teams that are working on it and the teams that are excited about it, and you know, how we can help to get that information out there.
Absolutely. I think, you know, there are several major things that I'm taking on in the book.
Okay.
So one of the areas that you didn't ask about, but that is really top of a lot of people's minds.
Okay, cool.
Is this notion of, well, all mental illness can't be due to metabolic problems. That seems like ridiculous, right?
Yeah.
And but even bigger than that question is, well, what is mental illness? How are you defining mental illness? And if you pay attention to social media, the battles are fierce.
Mm.
Everybody's got opinions, and they have strong opinions. So there are groups of people who think everybody's got a mental illness. And those people will say everybody should be in psychotherapy. Everybody needs a good therapist. And if you're not going to a good therapist, then you've probably got some mental problems that you're not dealing with. So there's that camp. Everybody's mentally ill. We all need therapy. Maybe we all need medication. And then there's another camp that says there's no such thing as mental illness. It's ridiculous. These are just unique, creative people. and we should not be slapping them with labels, and we should not be drugging them and poisoning them with psychiatric meds, and we shouldn't be humiliating them and ostracizing them by slapping a label on them. And I will be honest with you, I am in between. I believe that there are plenty of people on this planet who do not have a mental illness. I also believe that mental illness is real and that there are plenty of people who do have a real mental illness. But one of the places that the mental health field, I think, really misses the common sense mark right now is that we lump people who are coping with adversity in the same category as people who have brain disorders. And they are not the same thing. And let me give you a clear example. If a man, let's take a random man, he's married and has 2 kids. And he loves them very much. They're the center of his life. The wife and 2 kids are out and get hit by a drunk driver, and all 3 of them are killed. He gets depressed. He's allowed to be depressed for 13 days. If he's still depressed on day 14, according to the American Psychiatric Association, he now has a brain disorder. We call it major depressive disorder. He has a brain disorder. A lot of people would say, well, that's due to a chemical imbalance. His serotonin must be imbalanced. Now, anybody with common sense knows it ain't so. And yet those are our diagnostic criteria right now.
Right.
That is what the American Psychiatric Association says. However, there are other examples where I have met countless patients who will tell me, I don't know why the hell I'm so depressed. I have such a good life. My spouse loves me. My children love me. They would do anything for me. And yet I am so profoundly sad. I'm thinking about killing myself. I don't know what's wrong with me. That person, I believe, does have a disorder. It's a brain disorder that right now we should be calling major depressive disorder. I think the first person is a normal human being coping with adversity. And I think the second person has a metabolic brain disorder that we can treat. The first person needs treatment too, but the treatment for the first person is compassion and kindness and support. It's not putting them on chemicals to rebalance their chemicals. The second person has a metabolic brain disorder that we need to treat. If the pills that we were prescribing were so great, I would enthusiastically support them. But again, depression is now the leading cause of disability on the planet because those pills fail to work for far too many people. So I am going to be advocating for a comprehensive metabolic treatment plan for that second person and for the first person even, where we're taking in a holistic approach, we're looking at the science, and we're thinking about the science of what is actually happening. And, right now, so that is something that I do take on in the book, is distinguishing between normal responses to adversity and brain disorders. The trauma community in particular is very attuned to this issue. A lot of people in the trauma community will talk about symptoms that they have, and they are outraged that the mental health community wants to label them with PTSD and depression and ADHD and borderline personality disorder and all of these disorders, because they feel strongly that their symptoms are really about being traumatized and not being able to trust other human beings and never feeling safe. And that they should not be labeled with brain disorders. They should be labeled as victims of trauma. And that doesn't mean they don't need or deserve help, but the help, again, has a different model, as opposed to you've got a brain disorder of imbalanced chemicals and we need to give you chemicals to rebalance that. So that's one of the big things. In many ways, the bombshell is the unifying theory, but I think equally the bombshell is that what I'm arguing is that disorders like schizophrenia and bipolar disorder are actually not lifelong chronic disorders, that we can reverse them in the same way that you described that woman who reversed her bipolar disorder. She doesn't need her bipolar meds anymore. She's doing great. Her bipolar disorder went away. And right now, the field of psychiatry does not recognize that as even possible. Once you get that label, you are stuck with that label for life. And the mental health field says you need to be on medication for life because those symptoms are going to come back. We all know they're going to come back, and they are coming back, and there's no way around it. The metabolic theory of mental illness says otherwise. In the same way that we can reverse obesity, in other words, people can lose weight and keep it off, or in the same way that we can reverse type 2 diabetes, people can put their diabetes into remission, get off all diabetes treatments, and still have normal blood sugars. It's possible. I believe we can reverse many chronic serious mental disorders and that we can put them into remission. It doesn't mean that people can go back and start eating a lot of junk food and be in abusive relationships and use lots of drugs and alcohol. Because if they go back to the same things that were making them ill in the first place, their illness is probably going to come back with a vengeance. There's no way around it. But I think we can use lifestyle factors like diet and other things to put these illnesses into full and complete remission. And although that may sound far-fetched, you just mentioned the woman I know dozens and dozens of people who are living testaments to this possibility, that we can put these chronic brain disorders into full remission. And that will be a major shift in the paradigm of the mental health field. To say that if somebody comes in with schizophrenia, I want a medical approach to understanding, okay, this person's brain is metabolically compromised. What can we do to fix it? As opposed to right now, the standard of care is, oh, this person gets slapped with a label of schizophrenia, and then we all work to medicate them with medicines that will just keep them sedated and keep them out of trouble, hopefully. And then we all work to lower the expectations of the patient and family for the rest of this person's life. Just give up on having a job. Give up on finishing college. Give up on ever getting married and having kids. Like, that's just not in your cards because you've got schizophrenia. Sorry. That is where our field is at right now. And I strongly believe that needs to change, and it needs to change now in 2022.
I don't know that we can say it any better, or I can ask any more questions, but I'm 110% in agreement with you. I've seen it in real life. So I hope that this message gets to a lot of people. I really do. I did want to ask about trauma. And what's his name, Bethel, whatever, the
Bessel van der Kolk.
yeah, the body keeps the score kind of stuff. It just kind of amazes me, and Gabor Mate and stuff, these folks, that when I see people finally coming off of all the drugs, the sugars and the flours and whatever, if they really do stick to it, trauma begins to surface and stuff. And this seems to be like a soft science, warm and fuzzy. People don't quite get this part of it, ACEs, what's that, analogy, or adverse childhood experience.
Adverse child, yes.
People don't realize this issues are in the tissues, that these things begin to surface. What are your thoughts on all that? That's you mentioned the trauma community, and I just, again, another group that doesn't seem to get the play or the acceptance that this is real. And I've seen it hundreds of times with my own eyes, and people walk through it and out of it. It's not easy a lot of times, but they get it behind them, they get it processed, and they get it behind them. So what do you think? I mean, in combination with this, I just feel like they're using the drugs to hold those feelings down, and continuing to decimate their body because of it, and their brain, I guess, too, right?
Yes. So that is an area that I actually do I do a lot in the book with.
Okay.
I cover all of that: adverse childhood experiences, trauma, stress, in the book, and how it relates. So again, if we look at a group of people who have horrible adverse childhood experiences, or if we look at a group of people who are severely traumatized, they are more likely to go on to develop post-traumatic stress disorder. That's kind of a given. Everybody knows that. But guess what else? They're also more likely to develop just about every other mental disorder. They're more likely to develop a substance use disorder. They're more likely to develop depression, anxiety disorders, eating disorders, personality disorders. They're more likely to even develop bipolar disorder and schizophrenia. So trauma can cause just about every mental disorder. The neurodevelopmental disorders, because of when they occur in life, maybe not.
Right.
But all of the other disorders, yes. And but guess what else they're more likely to cause, as you suggested? They're more likely to cause metabolic disorders. They're more likely to cause obesity, diabetes, cardiovascular disease, and people with a trauma history are more likely to die early deaths. And that is the theme of my book, is that we can look at one root cause, trauma, and that one root cause is going to cause both mental disorders and all of the metabolic disorders.
Right.
We cannot talk about mental without talking about metabolic, and we can't talk about metabolic without talking about mental. They are inseparable.
Right.
And I think that, so when people are traumatized, as long as they continue to be in danger, they will have trauma symptoms. That is, again, that is being human. That is not a brain disorder.
Right.
Your brain is trying to protect you by making you hyper startle, by preventing you from sleeping soundly. If your life is in danger, you should not be sleeping 8 hours soundly. You shouldn't.
Right.
Because somebody might come and kill you.
Yeah.
And so you need to be sleeping very, very lightly, so that if anybody comes and tries to mess with you while you're asleep, you will wake up and be able to defend yourself.
Right.
But over time, sleep deprivation starts to take a toll on your physical body and also on your brain and your mental symptoms. And once that person is out of harm's way for an extended period of time, and that's going to vary on lots of, based on lots of circumstances. But once that person is out of harm's way, those symptoms, I do believe, can turn into a brain disorder. those symptoms can become overactive or they can fail to extinguish. In normal, healthy people, when they are out of harm's way, after a reasonable period of time, and again, depending on the trauma and how long it was lasting and everything else, for some people that might be several years, for other people it might be just a few months. But once they are through that period, they should be able to go on with their life. They should be able to not forget about it, but they shouldn't feel like they are being threatened every second of every day. And if their brain is still telling them you're threatened every second of every day, that can be an overactive part of that brain. And the overactivity of that part of the brain is actually a metabolic disturbance. And so even though we see the clear cause, the cause was trauma, I might consider using a dietary intervention in that person to calm that overactive part of their brain down. And in fact, we have a clinical trial of the ketogenic diet getting underway for post-traumatic stress disorder because there are enough cases of people who have used this diet, who had trauma histories, and their PTSD symptoms went away through a simple dietary intervention. And the way I see it as we were healing their brain through a metabolic treatment. However, I think that what you said is true as well. Mental and metabolic are inseparable. And so some people, if you start to engage in treatments and they've never dealt with their trauma, they still really don't feel safe. They still get triggered. They want to eat a lot of junk food to soothe themselves, or they want to drink alcohol or smoke weed or something. They just want to numb themselves with something.
Right.
That person may need a mental health treatment, psychotherapy, or something else to help them manage those feelings, what happened to them, to help them process it, and to figure out a way to move on with their life. And if we can help them through something like psychotherapy, that will, in fact, improve not just their mental symptoms, but it will improve their metabolic symptoms as well. And so I am a big fan of integrating mental health treatments and metabolic treatments together. And it goes both ways.
Right.
So if somebody's got obesity and is addicted to junk food, in part because of their trauma history, we might use a diet to help them lose weight, but we might also at the same time use some kind of trauma therapy to help them lose weight. Oh, and by the way, we'll also be helping their trauma symptoms with all of that too. I mean, we're integrating treatments to treat the whole human being,
Right,
and improve their overall health.
Yeah, I mean, you're tell me if you have to go, but you're answering the question that I've just been perplexing me forever, and it's this chicken and the egg a little bit, but this trauma that existed and exists was self-medicated with sugar. And that's a common construct in the alcohol and drug world. If you started using drugs and alcohol at 14 or 15, you stop growing emotionally. Well, imagine if you stopped growing emotionally at 2 or 3 years old, and you had this ubiquitous, always almost free product around that you could use, to handle whatever traumas or stressors came up in life. Now you wake up at 45 or 50, 150 or 100 pounds overweight, and you just stop it completely because, quote unquote, you want to lose weight. Then all of a sudden you start processing this stuff. And I'm trying to get the acceptance that the diet culture refuses to accept, that when you stop the white stuff or whatever, you begin a different journey about how you processed old trauma and new stressors. And this thing is like, I can't, like if I one-on-one with someone coaching, I can get them through it. But in a group setting, it's very difficult. You know what I mean? So you answered the question completely. And I'm really happy that you're getting this work out there in the world. I just, one of the things that I'm struggling for is the respect, Rodney Dangerfield, the respect of sugar, flour, caffeine, and nicotine as substance use, powerful enough substance use disorders to stop the feelings of trauma that you're trying to avoid. And then when you stop, you begin a process that's largely handled through talk therapy or group dynamics, right? And so I'm just trying to get this as a respect. It's not a diet. It's never a diet. It's never about just restricting white stuff, because if you restrict white stuff, and people say this to me all the time, I feel like I'm going crazy. I feel like I'm losing their mind. It's not attached to anything in their life. Their life is fine, but they have these feelings that, and then we start to talk about their traumas and whatever. So yeah, I mean, it's just, I'm really super excited to help you get this book out any way I can help, and just keep up the good work, man. What any last things you want to tell the folks before you tell them where they can get get it on Amazon, gang, just brain energy, and buy the, what do they call it? The pre-orders, so that this thing hits #1 when it does come out.
Thank you. So I've already accepted the reality that I'm not going to hit #1, because for better or worse, Michelle Obama has her next book being released on the exact day that mine is being released. So I'm sure Michelle Obama's book is going to be just a little bit bigger than Brain Energy, given that her last book was like one of the all-time best-selling books of ever. But but maybe I'll get #2. We'll see. So they can pre-order it. I think the big thing that I want to say, and I will seriously want to put a plug in.
Yes.
I am passionate about changing the mental health field. And I'm passionate about it because of the millions and millions and millions of people who are suffering, who have given up hope about getting better, who are taking lots of pills every day and not getting better, and sometimes feeling over-medicated or even poisoned by those pills. And right now, the system is not offering them anything. They are being told, well, sorry, you've got a treatment-resistant disorder. We're doing everything we can, and there's nothing more that can be done for you. I want that to change, and I want it to change as soon as possible.
Nice.
I want clinicians to start offering metabolic treatments. I want hospitals to be offering metabolic treatments. I want us to be paying attention to the hospital food that mental health patients are being served. I want people to have opportunities to be exercising and doing other things while they're in the hospital, because all of those things will improve their metabolic health and their mental health. And I want insurance to start covering services. Like right now in the United States, if you want to find a psychiatrist or a therapist, it's next to impossible. And then, God forbid, you should want to use your insurance to pay for that. That's really next to impossible. And all of that needs to change. And there's no way it's going to change without a grassroots movement. We have to rise up as people and demand something different. Demand that insurance companies start covering these services. Demand that hospitals and clinicians start offering metabolic treatments. Demand that people start getting just a little more respect for having real brain disorders, as opposed to just being whiners and complainers or crazy people. That there is so much work to be done. I'm honestly hopeful, I'm biased, but I'm hopeful that I have provided enough scientific evidence in this book to spark a movement, to spark a mental health movement, just like we had movements for HIV/AIDS, just like we had movements for breast cancer and Parkinson's disease. We can have a mental health movement, but one based on hope, one based on new science, one based on treatments that will actually work and heal, as opposed to just sedate people. And so I want to encourage you. It is not live yet. It'll be live hopefully in about a month, but there will be a website, brainenergy.com. And I am going to be inviting people to join the movement, whether you buy the book or not. Join the movement and get involved, and let's improve the lives of hundreds of millions of people.
Nice. You let us know when that goes live. We'll send out a couple 100,000 emails for you.
Thank you.
Yeah, for sure. Chris, I really appreciate this. Hang on for just a second, but gang, just amazing, just absolutely amazing. One of the best interviews I've ever done out of 300 or 400. So this is just really cool. So thank you so much for all your time and all the work that you're doing. It's just amazing. We'll talk to you guys real soon. Make sure you buy the book, Brain Energy, pre-order on Amazon. We'll talk to you guys soon. Bye for now.
Thank you.
Christy, there's the cut. Can you do me one favor for about 2 or 3 minutes, 4 maybe? We've been doing this little snippet that we're going to have. It's kind of the, not bloopers, but it's your life outside of your favorite Saturday, your favorite Sunday. How do you decompress? How do you not, how do you rejuvenate yourself? What gives you juice and joy? Can you do that for just a few minutes?
Sure.
Go for it.
Sure. So things that help me stay grounded and feel good and feel alive include staying on a good diet. I'm actually one of those people who is pretty extreme about early to bed, early to rise. I go to bed at 8 o'clock at night, but I wake up at like between 3 and 4:30 every morning.
Wow.
Never set an alarm. I just wake up when my body is ready to wake up. And that morning time is amazing for me. That is when I am drinking coffee and drinking water and writing or researching or just listening to music. Those are some of my most productive hours in the day. I am a huge fan of exercise. I love exercise. I do it every single day. In particular, I love cardio. I do weight training as well, but I love cardio. I'm addicted to cardio. So I will go run. I will go cycle for at least 30 miles or so most times. And yeah, I feel great. I feel alive when I'm doing that. I love connecting with people. I love having friends over, playing board games, just hanging out, talking. I sing karaoke. I won't do that for you now, but we do karaoke parties, and but yeah, those are just some of the
That's perfect.
spices of life for me.
No, I appreciate that. Chris, again, thanks again. It's just been an amazing time, and we'll do everything we can to get the book and promote it. So appreciate it.
Thank you so much, Mike.
All right, take care.
All right, bye.